So the next topic is, what are the locations of autonomic nervous system receptors that we are going to discuss. So locations of autonomic nervous system receptors we are going to discuss. So let's start with first, that is a parasympathetic system. So first of all, we'll discuss about the parasympathetic system. So let's recall all the points that we have discussed so far. Parasympathetic system is also known as cholinergic system. So this system is also known as cholinergic system. We also call it craniosacral outflow. Guys, why we call it craniosacral outflow? Because in this parasympathetic system, there are some nerves which start from cranial region. We call them the cranial nerves. Some nerves will start from sacral nerves. Now, who will tell me which cranial nerves are parasympathetic nerve? The answer is 3, 7, 9 and 10. And the sacral nerves which are parasympathetic nerves are known as S2 to S4. So we call them craniosacral outflow. This is the cholinergic system. The neurotransmitter here is acetylcholine. The neurotransmitter here is acetylcholine, and this acetylcholine will act on a receptor. The main receptor here is muscarinic receptor. So all these points we have discussed. Now let's go into detail the types of muscarinic receptors. So guys, please remember, if I talk about the muscarinic receptors, so for your exam, we can divide muscarinic receptors in 3 types. Basically, total muscarinic receptors are 5 in number. We have total 5 receptors present in human body. We call it M1 to M5, like M1, M2, M3, M4, M5. But for purpose of exam, only 3 receptors are important. So muscarinic receptors we can divide grossly for your purpose of examination in 3 types: muscarinic 1, muscarinic 2, muscarinic 3 receptor. We will not discuss muscarinic 4 and 5 because those are not important for your exam. So these are the 3 types of muscarinic receptors we have on which the parasympathetic nerves that are releasing acetylcholine, and that acetylcholine is going to act. Now, where we have the presence of muscarinic 1 receptor, please remember we have the presence of muscarinic 1 receptor in GIT. So in GIT, this receptor is present near to the parietal cell. So it is present near to the parietal cell of the GIT. And what is the purpose of parietal cell in the body, guys? So muscarinic 1 receptor present in GIT, that is a parietal cell. Now, what is the purpose of parietal cell? Parietal cell is mainly required for acid secretion. So whenever this receptor is stimulated, the acid is going to be released in the GIT. So in the GIT, typically in the stomach, whenever we eat the food, the acid is released because we have the presence of muscarinic 1 receptor on this parietal cells. Now we have this muscarinic 1 receptor also present in central nervous system. So muscarinic 1 receptor is also present in central nervous system. So whenever I stimulate muscarinic 1 receptor, even the CNS centers are also stimulated, and that can result in tremors as a manifestation. So muscarinic 1 receptor has 2 locations. One is the GIT, parietal cell, where it will lead to acid secretion, and in central nervous system, the second location where it is associated with tremors. Now we have the presence of muscarinic 2 receptor. Now, very important point about muscarinic 2 receptor is this receptor is a type of inhibitory receptor of parasympathetic system. So this receptor is a type of inhibitory receptor. And this receptor is mainly present over heart. So we discussed already all involuntary muscle, whether they are smooth muscles or the cardiac muscles, they have the muscarinic receptor. But on cardiac muscles, we can say that like on cardiac muscles, we have the presence of muscarinic 2, but on any other smooth muscle, we have the presence of muscarinic 3. Right? So where do we have the presence of muscarinic 3? All smooth muscles of the body. So all smooth muscles of the body have muscarinic 3, but on cardiac muscles, we have muscarinic 2, which is a type of inhibitory receptor. So muscarinic 2 is a type of inhibitory receptor. So whenever this receptor is stimulated, whenever muscarinic 2 receptor is stimulated, that is going to decrease the heart rate. That is also going to decrease the conduction in the heart. So that can reduce the conduction in the heart. So the potential that is started in the heart cannot move from atria to the ventricle. You must be knowing. In heart, we have different structure like SA node, atria, AV node and ventricle. So the conduction is slowed down. Conduction cannot spread from atria to ventricle, and the heart rate will also go down because the receptor is inhibitory type, that is going to inhibit the function of the heart. Now let's talk about muscarinic 3 receptor. Now where do we have the presence of muscarinic 3 receptor? Muscarinic 3 receptor is present on the surface of all smooth muscles, and this receptor is a type of stimulatory receptor, and that can result in smooth muscle contraction. So this receptor can result in contraction of smooth muscle. So smooth muscles will be contracted. So all smooth muscles will be contracted by this muscarinic 3 receptor. right? So muscarinic 3 receptor present on the surface of all smooth muscles, and all smooth muscles will be contracted. Like if I ask you this question, what will happen to bronchioles? You will answer me, sir, bronchioles are going to be contracted. If I ask you what will happen to the uterus is going to be contracted. What will happen to small intestine? The small intestine is going to be contracted. What happens to the pupil muscle? The pupil muscles are going to be contracted. But this receptor has one unique function that we'll discuss over here. This receptor is also present over endothelium of blood vessel. So this receptor is also present over endothelium of the blood vessels. So on the surface of endothelium of the blood vessels, we have the presence of muscarinic 3 receptor. Now, whenever I stimulate this muscarinic 3 receptor on the surface of blood vessel endothelium, this muscarinic 3 receptor will induce one enzyme over here. The name of the enzyme is nitric oxide synthase enzyme. So, in a blood vessel endothelium, we have the presence of muscarinic 3 receptor, which will stimulate one enzyme. The name of the enzyme is nitric oxide synthase enzyme. And when this nitric oxide synthase enzyme is stimulated or it is induced by this M3 receptor, this nitric oxide synthase enzyme will obviously synthesize the nitric oxide, and this nitric oxide which is synthesized over here is going to increase the level of an enzyme. The name of the enzyme is guanyl cyclase enzyme. This will increase the level of guanyl cyclase enzyme, and this guanyl cyclase enzyme will increase the level of cyclic GMP, and cyclic GMP will ultimately cause the vasodilation. So this is something which you have to remember, because there was a scientist who has proved this role of nitric oxide. Guys, you must have heard about the nitric oxide. Nitric oxide discovered in history because of this experiment which is done on this parasympathetic nervous system. So this experiment is related to the discovery of the nitric oxide. So nitric oxide is discovered in the endothelium of the blood vessels. So studies have shown this thing, that whenever we stimulate muscarinic 3 receptor in blood vessel endothelium, then one enzyme is induced in that endothelium. The name of the enzyme is nitric oxide synthase enzyme. And when this nitric oxide synthase enzyme is induced, this is going to form the nitric oxide, and nitric oxide will stimulate the guanyl cyclase. And when it will stimulate the guanyl cyclase enzyme, guanyl cyclase will increase cyclic GMP, and this cyclic GMP will cause vasodilation. So cyclic GMP will cause vasodilation. Right? So please remember, muscarinic 3 receptor. Muscarinic 3 receptor present on the surface of all smooth muscles, and all smooth muscles will be contracted. All smooth muscles will be contracted, but blood vessels are going to be dilated. And why these blood vessels are dilated? This is a vasodilation. Why this vasodilation or the blood vessels are dilated? Because this muscarinic 3 receptor will induce nitric oxide enzyme or nitric oxide synthesis in these blood vessels that will ultimately cause vasodilation. Now guys, here each and every step is an MCQ for your exam. Like this is an important MCQ, that muscarinic 3 receptor will induce which enzyme? Answer is nitric oxide synthase enzyme. Now what is going to form here? Answer is nitric oxide is going to form here. Now the very important question, this nitric oxide will induce which enzyme further? The answer is guanyl cyclase enzyme. So guanyl cyclase enzyme is induced further, and now this guanyl cyclase enzyme will increase what? Answer is increase cyclic GMP, and ultimately the vasodilation will take place. So all these points are important over here to understand. So what we have discussed so far, we are discussing the locations of the autonomic nervous system receptors. We have started with the first system, that is a parasympathetic system. So parasympathetic system, which is also known as cholinergic system. Why we call it cholinergic system? Because here the neurotransmitter is acetylcholine. This is also known as craniosacral outflow because the nerves are here mainly the cranial and the sacral nerves. Now acetylcholine will act on a receptor. The main receptor here is muscarinic receptor, which is actually of 5 types, but for exam purpose we have only 3 receptors which are important, so we are discussing only 3 receptors. Muscarinic 1 receptor is present on some special cells of the body. For example, it is present on the acid secreting cells and involved in acid secretion. It is present in central nervous system and involved in tremors, and this is the tremors. Like if you see the activity of my hand, this is the tremors. Now M2 is an inhibitory type of receptor which is mainly present over heart, and this is going to inhibit the activity of the heart. M3 receptor is present over all smooth muscles, and all smooth muscles will be contracted, but the same M3 receptor is present over blood vessel endothelium, and because of this blood vessel endothelium, a special mechanism comes into the picture, that is of nitric oxide, and with the help of nitric oxide this will cause vasodilation. Right? Now with the help of this muscarinic receptors, what are the actions of this parasympathetic system you can see in the body? So what are the actions of parasympathetic system? So if we talk about parasympathetic system, so parasympathetic system nerves will release acetylcholine. Now acetylcholine will act on the muscarinic receptor, and with the help of muscarinic receptor, this parasympathetic system can result in some actions, and you can remember all these actions of parasympathetic system with the mnemonic. The mnemonic is dumbbells. So the mnemonic is dumbbells, right? So these are the actions which parasympathetic system can produce in the human body with the help of muscarinic receptor. So mnemonic to know the actions of parasympathetic system is dumbbells. So here in this mnemonic, all the actions are mainly due to the muscarinic 3 receptor. All the actions are mainly due to the muscarinic 3 receptor, but only the cardiac effect, only the effect on the heart, effect on the cardiac cells is due to the muscarinic 2. All actions are due to muscarinic 3, but only the effect on heart is due to muscarinic 2, and acid secretion may we have the involvement of muscarinic 1 also. So let's discuss the full form of dumbbells first, then you will come to know. Number 1. So here the D stands for diarrhea. So parasympathetic system is responsible for increased peristalsis of GIT. So parasympathetic system can result in increased peristalsis of GIT. So if this system is active, the food can move from stomach to intestine, and now we can absorb the food. And if there is a overactivity of parasympathetic system, this can result in diarrhea also. Number 2, so D also stands for dilatation of the blood vessel. So D also stands for dilatation of the blood vessels. So this we have discussed already. So parasympathetic system can release nitric oxide by acting through muscarinic 3 receptor and can cause vasodilation. So dilatation of the blood vessel can be seen. Now this dumbbells mnemonic, the U stands for urination. So please remember, parasympathetic system can contract the bladder. So parasympathetic system can contract the bladder. We call it urination. The same parasympathetic system can result in meiosis. So M stands for meiosis because the eye muscles are also contracted. So eye muscles are also contracted. So pupillary muscle is contracted. So pupillary muscle is contracted because of muscarinic 3 receptor, and that will result in meiosis. So this system can cause meiosis. Now just along with meiosis, please remember one more system of the eyes, that is known as accommodation. So parasympathetic system can contract eye muscles. So when you contract the pupillary muscle, that result in meiosis, but there is a lens muscle also. So we have a ciliary muscle of lens. So whenever the ciliary muscle of lens is contracted, so we have a ciliary muscle of lens. Guys, please remember, we have two types of muscles in the eyes. We have two muscles in the eyes, like the muscles which are present inside the eyeball. I'm not talking about the muscles which are present outside the eyeball. We have two types of eye muscles present outside the eyeball. We call them the extraocular muscles, like superior rectus, medial rectus, inferior rectus. Now those muscles are under our control. So those extraocular muscles are somatic muscles. They are not the autonomic muscles because they are the voluntary muscles. Now we have two muscles present inside the eyeball. So when I open the eyeball, like during surgery, when I open the eyeball, I will find two muscles inside the eyeball. One muscle is present in relation to the pupil, or we also call it iris, right? The muscle is present in relation to the iris or the pupil. We call it pupillary muscles or the iris muscles. And whenever that muscle will contract, we call it meiosis. And we have a second muscle which is present in relation to the lens of the eye. So whenever this lens muscle is contracted, we call it ciliary muscle of lens. The outcome is accommodation. Right? So in this mnemonic of dumbbells, U stands for urination, M stands for meiosis with accommodation. Next talk about B. So in this mnemonic, if we go, so B stands for bronchospasm. So muscarinic 3 receptor can also result in bronchospasm and the bronchoconstriction. So this results in bronchospasm and the bronchoconstriction. And now here the B also stands for bradycardia. So B also stands for bradycardia. Now this cardiac effect, the bradycardia is a cardiac effect. The heart rate will go down. This is due to muscarinic 2 receptor. So bradycardia is due to muscarinic 2 receptor. Rest all actions are mainly due to muscarinic 3 receptor. So in this mnemonic of dumbbells, D stands for diarrhea, D stands for dilatation of blood vessels, U stands for urination, M stands for meiosis with accommodation. So accommodation is a process, like whenever we want to see any object which is coming close to the eye. Whenever we want to see any object which is coming close to the eye, we require the change of the curvature of the lens. So our lens curvature will change. This process is known as accommodation. So whenever we want to accommodate the object, whenever we want to accommodate the image of the object on the retina, our lens muscle is contracted. This process is known as accommodation. Now here the B stands for bronchospasm or bronchoconstriction. B also stands for bradycardia. Next is, so in this topic of dumbbells, so B we have discussed. Now come to the E. So please remember guys, E stands for male reproductive organ, penis, that is erection. So E stands for erection. So please remember, parasympathetic system will cause penile vasodilation. So we have the presence of blood vessels in the penis. So blood vessels get dilated in the penis. So blood vessels get dilated in the penis. So penile vasodilation will take place. So penile vasodilation will take place, and as a result of penile vasodilation, erection will occur. Now, how this penile vasodilation will take place? The same mechanism, the nitric oxide mechanism, and this nitric oxide will induce which enzyme? Who will answer me this question? So nitric oxide will induce an enzyme. We call it guanyl cyclase enzyme. So with the help of guanyl cyclase enzyme, cyclic GMP level is raised, and that will cause erection. Next is L. L stands for lacrimation. So please remember, all glandular cells, all cells of the glands are also stimulated by the parasympathetic system. So there's a lacrimation, right? So in this mnemonic, dumbbells, S stands for salivation. So S stands for salivation, L stands for lacrimation, right? And here S also stands for sweating. S also stands for sweating. So lacrimation, salivation and sweating will occur, and all these things are related to the glandular secretions. So all glandular secretions are increased by the muscarinic 3 receptor. All glandular secretions are increased by the muscarinic 3 receptor. The last is, like you can, in this mnemonic or dumbbells, you can see we have written 3S. So 2S we have discussed. So L is for lacrimation, S is for salivation, S is for sweating. Now the last S is for secretion of the acid. Secretion of the acid. Now secretion of the acid is due to the parietal cell, and in parietal cell which receptor is present, guys? This is important. So mainly we have M3 receptor. Mainly we have M3 receptor, but here we also have the presence of muscarinic 1 receptor. So secretion of acid, mainly we have again M3 receptor, but we also have the presence of muscarinic 1 receptor that is involved in acid secretion. So this is the full form of this mnemonic, that is dumbbells. So what we have discussed so far? We have discussed so far that parasympathetic system get activated as long as we are not in stress, and this is also known as cholinergic system. The neurotransmitter is acetylcholine. We also call it craniosacral outflow. We have 4 cranial nerves, 3, 7, 9, 10, and we have the sacral nerves S2 to S4. The neurotransmitter here is acetylcholine. The receptor here is muscarinic receptor, which is of 5 types. Right? Out of these 5 types, the 3 receptors are important for our exam: M1, M2, M3. The muscarinic 1 receptor present in GIT, involved in acid secretion, present in CNS, involved in tremors. M2 receptor is an inhibitory receptor, can inhibit the activity of the heart. Muscarinic 3 receptor can contract all smooth muscles of the body and can also release nitric oxide in the blood vessels and can dilate the blood vessels also. Right? Now we have the actions of parasympathetic system through this muscarinic receptor. Mnemonic is dumbbells. In this mnemonic or dumbbells, the D stands for dilatation of blood vessels as well as the diarrhea. U stands for urination. M stands for meiosis with accommodation. B stands for bronchospasm and bradycardia. E stands for erection. L stands for lacrimation. S stands for salivation, S stands for sweating, and S also stands for secretion of the acid. So all these actions of parasympathetic action, parasympathetic system will take place in human body. Now after this action, let's talk about the acetylcholine synthesis and its metabolism. So how the acetylcholine synthesis and its metabolism will take place in the body. So now we are going to discuss the acetylcholine synthesis and acetylcholine metabolism in the body. So parasympathetic system, we know that it is known as cholinergic system. Why we call it cholinergic system? Because here the neurotransmitter is acetylcholine. So it's how this acetylcholine synthesis will take place and how finally this acetylcholine get metabolized in the body. So if we talk about acetylcholine synthesis, as the name suggests, acetylcholine. As the word is acetylcholine, it is made up of 2 things. One is acetyl, second is choline. So what happens exactly here? Acetyl combines with choline. So acetyl, which is present in the form of acetyl coenzyme A. So in human body, acetyl is present in the form of acetyl CoA. So this will combine with choline, and now there is a synthesis of acetylcholine. So acetylcholine synthesis will take place in the body. How it exactly takes place, this is not important for your exam. So just remember, acetylcholine synthesis will take place whenever acetyl combines with choline. This is going to form the acetylcholine. Now, when this acetylcholine is formed in the body, this acetylcholine will be stored in a vesicle. So, if I say this is a nerve ending, this is a nerve, right? So, I will say this is a cholinergic nerve. So, in this cholinergic nerve, acetyl combines with choline and this will form acetylcholine, right? Now, this acetylcholine, whatever is formed over here, this acetylcholine is shifted to this structure. The name of the structure is vesicle. So, this is the vesicle. What is vesicle, guys? Vesicle is a structure where the neurotransmitter is stored temporarily. So vesicle is a structure which is present at the end of all nerves of the human body. So all nerves of the human body, we have the presence of this storage granule. We call it vesicle. So here in this parasympathetic nerve, we have the presence of this vesicle where acetylcholine which is formed in this nerve will come and get stored. Now whenever body requires, this acetylcholine is released. So acetylcholine is released in the body, and when this acetylcholine is released, this acetylcholine will act on a receptor. The name of the receptor is muscarinic receptor. So acetylcholine will act on an organ which is present on the surface of that organ. We call it muscarinic receptor, and ultimately which actions will take place? The actions that we have discussed already, that is dumbbells. So this is your parasympathetic nerve, and parasympathetic nerve, acetylcholine synthesis will take place when you combine acetyl with choline, and now whatever acetylcholine is formed, that is going to stored in the vesicle, and when this acetylcholine is stored in a vesicle, whenever body requires, acetylcholine is released in the body, and acetylcholine, when it is released, it will act on its muscarinic receptor and can perform the action. We call it dumbbells. Now, how this acetylcholine is released, that we'll discuss physiology. We'll discuss the physiology of the acetylcholine release. So guys, please remember, we have the presence of two things over here. So at the ending of the nerve, we have the presence of two things which are involved in this acetylcholine release in the body. So first is presence of fusion proteins. So we have presence of some fusion proteins, and with the help of this fusion proteins, the acetylcholine vesicle fuses with this membrane, and now the acetylcholine is released. So we have the presence of fusion proteins. With the help of fusion proteins, acetylcholine is released in the body. Right? Now here we have a presence of a very important protein. We call it SNAP25. So SNAP25 is a name of a fusion protein that is present over here and that is involved in this release of acetylcholine. So first protein here is fusion protein. We call it SNAP25 protein. Now once this SNAP25 protein will act, now acetylcholine will come close to this membrane, and now we have an entry of an ion. So one ion that is also involved in this release is calcium. So calcium is the ion that will take entry, and when this calcium will take entry, acetylcholine is released. So these points are important for your physiology. So fusion protein, the name of the fusion protein is SNAP25 protein, and which ion will take entry? Calcium will take entry. Ultimately, the acetylcholine is released in the body, and the action will take place on the muscarinic receptor. We call it dumbbells. Right? Now, let's talk about some drugs which will act on this pathway. So we have a presence of a medicine that can act on this pathway, and that medicine can block the release of acetylcholine. So just remember the name of a drug. The name of the drug is botulinum toxin. So we have a presence of a drug over here. The name of the drug is botulinum toxin. So botulinum toxin is a name of a medicine. Actually, this is a toxin that we have derived from a bacteria. The name of the bacteria is Clostridium botulinum bacteria. So we have a bacteria, we call it Clostridium botulinum bacteria. Just remember Clostridium bacteria. Now from this Clostridium bacteria, we have derived this toxin, we call it botulinum toxin. Now whenever this toxin we can use as a drug. Now whenever I inject this medicine in a patient, this medicine will go and block this fusion protein. This medicine will go and block this fusion protein. And when this medicine will go and block this fusion protein, now the calcium entry is also not possible, because calcium entry is only possible after the fusion protein will act. So once the fusion protein will act, only then the calcium will take entry and acetylcholine is ultimately released. So botulinum toxin is a drug which is going to block this SNAP25 protein, and once this SNAP25 protein is blocked, now the calcium entry is also not possible, and once the calcium entry is also not possible, now the excess of acetylcholine release is blocked. So botulinum toxin is a blocker of acetylcholine release, and this is a medicine which is important, very important for your exam. Not only important, very important for your exam, that you have to understand here. So what we have discussed so far, acetylcholine synthesis, acetylcholine storage, and we have a drug, botulinum toxin, that will act over here and block the release of acetylcholine. So this medicine is important for your exam. We'll discuss this medicine in detail. So what is the name of the drug? The name of the drug is botulinum toxin. So we have discussed already that botulinum toxin is a very important drug for your exam. So we'll discuss all the MCQs which have already been asked in relation to this medicine. So the first MCQ, what is the origin of this drug? So where we have developed this medicine, botulinum toxin? So answer is, we have derived this medicine from a bacteria. We call it Clostridium botulinum bacteria. So we have derived this medicine from Clostridium botulinum bacteria. So the name of the bacteria is Clostridium botulinum, and the toxin that we used clinically is known as type A toxin. So type A toxin is the most commonly used form of the toxin that we use clinically as a drug. Now, what is the mechanism of action of this medicine? So the mechanism of action is, this drug is irreversible blocker. This medicine is irreversible blocker. This medicine is a irreversible blocker of SNAP25 protein. Guys, what is SNAP25 protein? It's a type of a fusion protein. So this medicine is irreversible inhibitor of a fusion protein. We call it SNAP25 protein. Now, once it will block the SNAP25 protein, what will happen? The calcium entry is not possible. And when this calcium entry is not possible, then acetylcholine release is also not possible. So this medicine is ultimately blocker of acetylcholine release by blocking the SNAP25 protein and also block the calcium entry indirectly. Now, because this medicine is irreversibly blocker, because this medicine is producing a irreversible change in the body, so body will take long time to recover from this effect. And because body will take long time to recover from this effect, this medicine action is long lasting. So this medicine action is long lasting in the body. So whenever you inject this medicine, the medicine action is seen up till 3 months. So medicine action is long lasting. You can see the medicine effect till the long term, till the 3 months, because the medicine is irreversible blocker of SNAP25 protein. Now, what is the route of administration? How this medicine is given to a patient? So please remember, this medicine is given by the local route. So this drug is not given by the systemic route, because if you give this medicine by the systemic route, patient will develop the toxicity. So you give this medicine by the local route. Now guys, what is the difference between local and the systemic route? Systemic route means, like, whenever you give a drug to a patient, to reach its target, to medicine to reach its target, the medicine has to take entry in the plasma. So if your drug will take entry in the plasma to produce its effect, that route is systemic route. But if a drug is injected at a place wherever disease is already present, so like if I have a lesion over in my skin, if I apply the medicine on the skin directly, so medicine will not take entry in the plasma. Medicine will directly act on the disease. Medicine will not take entry in the plasma. So this is the local route. So when the medicine need not to take entry in the plasma to produce its effect is known as the local route. But if the medicine has to take entry in the plasma to produce its effect is known as the systemic route. So this medicine will not inject in the plasma because this drug is a toxin, can result in toxicity in the patient. So this medicine is preferably given by the local route. Now, what are the indications of the medicines? Where do we use this medicine? So this medicine is given for the treatment of some muscle spasm. So by inhibiting the release of acetylcholine, this medicine can cause muscle relaxation. So medicine can be given for the treatment of muscle spasm. For example, this medicine can be given for the treatment of blepharospasm. Blepharospasm is a condition where the eyelid muscle, the muscles of the eyelid are in spasm. So medicine can be given for the treatment of blepharospasm. Medicines can be given for the treatment of wrinkles which are present over face. So blepharospasm, guys, it's a spasm of the eyelid muscle. You can inject medicine directly in the eyelid muscle, so the eyelid muscle will get relaxed. Wrinkles means, like, if you can see, the wrinkles are present on my forehead. This is a type of wrinkles. So the aging process, when the person become old, the wrinkles are present. So when I inject this medicine in this wrinkle, the wrinkles get flattened out. And when this wrinkle gets flattened out, because the muscles get relaxed over here, acetylcholine cannot be released by the nerve that is supplying these muscles. So the muscles get relaxed. So I can use this medicine for the treatment of blepharospasm. I can use this medicine for the treatment of wrinkles which are present over face. So all these are important MCQs which can be asked in relation to this medicine, botulinum toxin. So what we have discussed so far, we have discussed about the acetylcholine synthesis, as well as we have talked about the medicine that will act on this acetylcholine release. Now let's talk about acetylcholine metabolism. So how the acetylcholine is finally metabolized in the body. So please remember, whenever acetylcholine is released by the nerve, so acetylcholine has come from the nerve. Now, acetylcholine is metabolized by an enzyme. The name of the enzyme is acetylcholine esterase enzyme. So we have the presence of acetylcholine esterase enzyme. With the help of this enzyme, acetylcholine get metabolized. Now, if I have to draw the structure of acetylcholine esterase enzyme, I will draw the structure like this way. So this is a unique enzyme of the body. This is the unique enzyme of the body, and in which respect it is unique? The unique point of this enzyme is this enzyme has two active site. This enzyme has two active site instead of the one active site. Most of the enzymes of the body have one active site, but this is the enzyme which has the two active site, and therefore the acetylcholine has to bind with the two sites of this enzyme and then it gets metabolized. So what are the two sites which are present on this enzyme? First is known as the anionic site, which is having the negative charge. The first site is known as the anionic site, which is having the negative charge. The second site which is present on this enzyme is known as the esteric site. Now this esteric site has a tendency to open or the metabolize the ester bond. So esteric site has a tendency to metabolize the ester bond. Anionic site is a negative charge site. Now whenever acetylcholine has come from the above, now acetylcholine contains positive charge. Acetylcholine also contains the ester bond. So in the structure of acetylcholine, we have the presence of ester bond. In the structure of acetylcholine, we also have the presence of positive charge. So whenever acetylcholine molecule will come over here, the positive side, the positive charge containing side of this acetylcholine will come and bind with the anionic site, and the ester bond of the acetylcholine will come and bind with the esteric site. So ester bond will bind to the esteric site and positive charge side will bind to the anionic site, and ultimately the whole molecule of acetylcholine get metabolized. So this is how the acetylcholine metabolism will take place. So acetylcholine metabolism is possible with the help of acetylcholine esterase enzyme. The only important point here is this enzyme has two active sites. What are the names of two active sites? One is known as anionic site, second is known as esteric site, and acetylcholine is metabolized with the help of both sites together. So both sites are required together for the metabolism of acetylcholine. If any of the site is not available, acetylcholine metabolism is not possible. So this is all about this parasympathetic system, the basic discussion, the physiology of parasympathetic system we have discussed. So let's go back and revise this parasympathetic system again. So for this parasympathetic system, we have discussed that we call it cholinergic system. So this system is also known as cholinergic system because the neurotransmitter here is acetylcholine. The nerves are started from cranial and the sacral region, so we also call it craniosacral outflow. Acetylcholine, which is released in this system, will mainly act on muscarinic receptor. And we have three important receptors in the body where this acetylcholine can act, M1 to M3. Muscarinic 1 receptor present in GIT helps in acid secretion, as well as present in CNS involved in irregular contraction of the muscles. We call it tremors. Muscarinic 2 receptor, inhibitory type of receptor present over heart, inhibit the activity of the heart. Muscarinic 3 receptor present over all smooth muscles, and all smooth muscles are contracted. But the same muscarinic 3 receptor is also present over endothelium of the blood vessel, which is not a muscle, but this is a special cell of the body. And in this endothelium, the nitric oxide is synthesized, and this nitric oxide will cause vasodilation. Now, this parasympathetic system, with the help of this muscarinic receptor, can result in various actions. The mnemonic is dumbbells, where the D stands for diarrhea, urination, meiosis with accommodation, bronchospasm, bradycardia, erection, lacrimation, salivation, sweating, as well as secretion of the acid. So, various actions we have discussed already. Now, after this section, we have discussed how the acetylcholine synthesis and its metabolism take place. So, acetylcholine synthesis, when acetyl combines with choline, this will form acetylcholine. Acetylcholine gets stored in a vesicle, and when we require acetylcholine, it is released in the body with the help of fusion proteins like SNAP25 protein, as well as with the help of iron, we call it calcium ion. So we have a drug over here. The drug name is botulinum toxin. So botulinum toxin is a medicine which is blocker of this fusion protein. And once this fusion protein is blocked irreversibly, the calcium entry is also not possible. And when this calcium entry is not possible, acetylcholine release is also not possible. And ultimately, all these actions, that is dumbbells, are not going to take place in the body if I give botulinum toxin to a patient. Right? So these are the various MCQs that we have discussed regarding the origin. The bacteria name is Clostridium. The toxin is type A toxin. The mechanism of action is irreversible action. That's why the action lasts for long term. That's for 3 months, the long lasting action of the drug. The drug is given by local route, and medicine is mainly given for the muscle spasm like blepharospasm, or we have the presence of wrinkles over face. Then acetylcholine metabolism, it is possible with the help of an enzyme, acetylcholine esterase enzyme, which has two active sites. One is known as anionic site, second is known as esteric site, and finally this acetylcholine get metabolized. Now, after this basic discussion of parasympathetic system, let's talk about the drugs which act on this parasympathetic system. So if we talk about the medicines or the drugs which act on this parasympathetic system, I can divide the medicines which act on this parasympathetic system in two groups. So we have the cholinergic drugs. We have the cholinergic drugs. So as the name suggests, cholinergic drugs, these are the drugs which will promote the dumbbells effect. So cholinergic system can cause dumbbells. Cholinergic drugs are those drugs which will increase the parasympathetic effect. And just opposite to cholinergic drug is known as anticholinergic drugs. Just opposite to it, we call it anticholinergic drugs. So anticholinergic drugs are those medicines which will do the actions which are just opposite to dumbbells. So cholinergic drugs will do dumbbells. Anticholinergic drugs which are just opposite. Anti means the opposite. So these medicines will do the actions which are opposite to dumbbells. Let's start with the first topic, the medicines which are known as cholinergic drugs. So we're going to start with the first topic, we call it cholinergic drugs. Now if we talk about the cholinergic drugs, now these cholinergic drugs we can divide in two groups again. Cholinergic medicines we can divide further in two groups. Number one, the first group of medicines are known as directly acting medicines. The second group of medicines are obviously known as indirectly acting. So we have two types of medicines. One is known as directly acting. The second is known as indirectly acting medicines. So we have two types of medicines, directly acting and indirectly acting medicines. Now if we talk about directly acting medicines, if we talk about the directly acting medicines which will act over here, right? So directly acting medicines are those which will directly act on muscarinic receptors. Directly acting medicines are those which will directly come and act on the muscarinic receptor, right? Now, what are the indirectly acting medicines? Now, indirectly acting medicines, as the name suggests, indirectly acting. They will not directly act on the receptor, but what these medicines will do, these medicines are inhibitor of an acetylcholine esterase enzyme. So, these medicines inhibit acetylcholine esterase enzyme. So, by inhibiting acetylcholine esterase enzyme, acetylcholine activity will increase. Acetylcholine will not get metabolized in the body. So indirectly acting, they will not act on receptor directly, but these medicines will inhibit the acetylcholine esterase enzyme. So by inhibiting the acetylcholine esterase enzyme, acetylcholine metabolism will not take place. Acetylcholine will stay in the body for a longer time, and now this acetylcholine will act on a muscarinic receptor for a longer time. So ultimately the muscarinic receptors are stimulated here again. So muscarinic receptors are also stimulated here again, but now in this case the medicines are not going to stimulate the receptor directly. Medicines will stimulate the receptor indirectly. So this is the indirect action of the drug. So we have two types of medicines. One is known as directly acting medicines. The second is known as indirectly acting medicines. So both medicines will ultimately do the actions, that is dumbbells. So both medicines will ultimately do the actions, that is dumbbells. Now this dumbbells effect can be produced by directly or can be produced indirectly. Now let's talk about the directly acting medicines first. So in this directly acting medicines, we have to cover two medicines in detail. The first medicine which is directly acting, the medicine name is bithenecol. So we have a medicine, the medicine name is bithenecol. So the drug name is bithenecol. So as the name suggests, bithenecol. So medicine name ends with the word col. So col means cholinergic. So here it's easy to remember, this medicine is a cholinergic drug. This medicine is a cholinergic drug, can result in dumbbells effect. Cholinergic means dumbbells effect. Now, this medicine bithenecol starts with the alphabet B. So, medicine is a cholinergic drug, starts with the alphabet B. So, this medicine which starts with the alphabet B, this medicine will go and stimulate the bladder muscle. So this medicine will contract the bladder muscle. So we discussed already, the mnemonic is dumbbells. U stands for urination. So this medicine can contract the bladder muscle. And once this medicine will contract the bladder muscle, this medicine can result in urination. So this medicine will help in urination, and because this medicine will help in urination, where I can use the medicine? So medicine which can contract the bladder can result in urination. I can use this medicine for a treatment of a condition where the patient bladder muscles are already inactive. So if the patient bladder muscles are hypoactive, inactive, they are not contracting at all, urine is accumulating in the bladder. So this medicine is considered as drug of choice. This medicine is considered as drug of choice for atonic bladder. This medicine is considered as drug of choice for atonic bladder, where the bladder muscles are hypoactive. This is also known as hypoactive bladder. This is also known as hypoactive bladder, atonic bladder, where the bladder muscles are not contracting at all. And because of this bladder muscles which are not contracting, urine will retain in the body. So there is a urinary retention. So patient will suffer from urinary retention, and when the patient will suffer from retention of urine, ultimately what will happen? The urine is keep on accumulating. Urine is keep on retaining in the bladder cavity. So there is a retention of the urine in the bladder. So this urine is keep on increasing, and ultimately a stage will come when the bladder sphincter cannot hold this much of pressure. And when this bladder cannot hold this much of pressure, urine will start overflowing. So there is an overflow of urine once the bladder is full. So once the bladder is full, the urine is retaining in the body. Urine is retaining in the bladder. Once the bladder is full, the urine will start overflowing from the bladder cavity. And when this urine will start overflowing from the bladder cavity, automatically by itself, without the intention of the patient to pass the urine. Try to understand my words. I am saying the urine is coming out automatically from the bladder cavity because of the overflowing. Because the bladder cavity is full, the urine is overflowing from the bladder cavity, and the urine is coming out without the intention of the patient to pass the urine. Patient does not want to pass urine, but still the urine is leaking out of the bladder cavity. So this problem is known as incontinence, and the name given to this problem of incontinence is overflow incontinence. So this is known as overflow incontinence. So overflow incontinence is a condition where the patient bladder is hypoactive. When the patient bladder is hypoactive, urine is accumulating in the bladder cavity, and after some time urine will start overflowing. We call it overflow incontinence. The condition is atonic bladder, hypoactive bladder. The drug of choice or the best medicine is bethanechol. So bethanechol is the best medicine for the treatment of overflow incontinence. Now, not only this, sometimes what happens after surgery? After surgery, the patient will have problems of passing the urine. So that problem is known as post-operative. That problem is known as post-operative retention of urine. So post-operative retention of urine, I can use the medicine bethanechol. Basically, this medicine can contract the bladder, and because this medicine can contract the bladder, wherever or in any of the condition wherever the patient urine is retaining, I can use the medicine bethanechol. So bethanechol can be given for the treatment of overflow incontinence, or wherever the patient has the bladder, atonic bladder, the bladder is not contracting. You can give this medicine, the patient condition will improve. Medicine is also given for post-operative. After surgery, there is retention of urine. I can use the medicine. The drug name is bethanechol. The first directly acting medicine we have discussed is bethanechol. Now let's move on to the second directly acting medicine. Now which medicine is a second directly acting medicine? The second directly acting medicine is pilocarpine. Second medicine is pilocarpine. Now pilocarpine is a drug which is used in the form of eye drops. So pilocarpine is a medicine which is used in the form of eye drops. So pilocarpine eye drops we use clinically. Now what will happen when I put this pilocarpine eye drop? This medicine will again produce the dumbbells effect. So what is the effect in the eyes? What is the effect in the eyes, guys? So answer is pilocarpine eye drops. Whenever I put in the patient eyes, this pilocarpine will cause meiosis. So pilocarpine when I used in the form of eye drops, the dumbbells may M stands for meiosis. So pilocarpine will cause meiosis. And when this pilocarpine will cause meiosis, as a result of that, what will happen? Now as a result of that, there is an increased drainage. Because of the meiosis, there is an increased drainage of the aqueous humor. There is an increased drainage of the aqueous humor. What is, guys, aqueous humor? Aqueous humor is a fluid which is present in the eyes, right? So there is an increased pouring. We can say there is an increased pouring of the aqueous humor in a very special space in the eyes. We call it trabecular meshwork, right? So we have a very special tissue in the eyes. We call it trabecular meshwork. So pilocarpine is a drug. This medicine will cause meiosis. Now because of the meiosis, the pupil become small. Pupil becomes small. But when this pupil becomes small, the pupil will come from periphery towards the medial side. Now when this pupil will come from periphery towards the medial side, the pupil size will become very small. But the peripheral angle, we have an angle between iris and the cornea. We have an angle between iris and the cornea. That angle will become wide. So pilocarpine is a drug. So this details will be discussed in your ophtha class. So when you attend the ophtha class, you will come to know the basic anatomy of the eye. There you will come to know whenever the pilocarpine will cause meiosis. Whenever the pilocarpine will cause meiosis, this medicine will cause widening of the peripheral angle. So as a result of meiosis, this medicine will cause widening of the peripheral angle. So peripheral angle which is present in the eyes. So pupil will come towards the middle side. The pupil becomes small, the angle will become wide. They are just opposite to each other. So pilocarpine will make the angle small, the pupil, the angle in the eye become wide, and when this angle will become wide, this will result in increased pouring of the aqueous humor in the trabecular meshwork or increased drainage of the aqueous humor in this trabecular meshwork. Now, as a result of this increased drainage of the aqueous humor in the trabecular meshwork, what will happen? The intraocular pressure. The intraocular pressure is reduced in the eyes. So I can use this medicine for the treatment of a glaucoma. We call it closed angle glaucoma or the angle closure glaucoma. So I can use this medicine for the treatment of a glaucoma. We call it angle closure glaucoma. Angle closure glaucoma is a disease where the patient peripheral angle, the angle which we have widened over here, the same angle is now closed. So that angle is closed, and because that angle is closed, the aqueous humor drainage is not possible. Aqueous humor drainage is not possible. So in the eyes, we have a presence of an angle. So if that angle is closed, the aqueous humor cannot be drained in that angle. So aqueous humor is keep on retaining in the eyes, and that will increase the pressure in the eyes. We call it angle closure glaucoma. So if I open up the angle, if I cause the widening of that angle, now the pouring of the aqueous humor or the drainage of the aqueous humor will increase. And when this drainage of aqueous humor will increase, I can reduce the intraocular pressure and I can use this medicine for the treatment of angle closure glaucoma. So the drug name is pilocarpine, right? Now, what are the side effects of this pilocarpine? This question can be asked in your exam. So if I talk about the side effects of pilocarpine, now pilocarpine side effect you can remember by the mnemonic, that is 4P. Right? So guys, you can imagine, like if you want to remember pilocarpine, there are many P's over here. Like pilocarpine is a drug that starts from alphabet P. This medicine starts from alphabet P. This medicine will cause widening of P angle, that is a peripheral angle. This medicine will cause widening of peripheral angle, can increase the pouring of aqueous humor in a trabecular meshwork. So increase the pouring of aqueous humor in a trabecular meshwork, right? Reduce the pressure in the eyes, that is again a P, and this medicine can also result in a side effect that is also starting from P. So drug name is pilocarpine. One more way of remembering the drug is pilocarpine is a drug which starts from alphabet PI. And this medicine will cause meiosis. Meiosis means the pupil size will become very small. The pupil size is just like a pinpoint, just like a point of a pin. So we call it pinpoint pupil or the meiotic pupil. So PI is pilocarpine. It will result in pinpoint pupil. So what are the side effects of pilocarpine? This medicine will make the pupil pinpoint. And because this medicine will make the pupil pinpoint or the meiotic pupil, on one side the angle become wide and the drainage will start. But on other side, what will happen? When this pupil will become pinpoint, it means the muscles of the pupil will contract. Muscles of the pupil will contract. So because of the muscle contraction, because of the pupillary muscle contraction, the pupil has become pinpoint. That can cause pain in the eyes. So that can cause pain in the eyes. And because of this pinpoint pupil, patient cannot see the things clearly. Patient vision is reduced. So patient vision remain less because of the pinpoint pupil. Number two, the patient will have pain in the eyes. Number two side effect, or we can say number three side effect. So first is like pinpoint pupil. Second is pain in the eyes. If I talk about the third side effect of the medicine, now this pilocarpine can block the nasolacrimal duct. Pilocarpine eye drops can block the nasolacrimal duct. Guys, what is nasolacrimal duct? You must be knowing. Nasolacrimal duct is a duct that can drain the tears. So whatever tears are produced, that are drained by this nasolacrimal duct. So we have the presence of this nasolacrimal duct. So in ophtha class, you will see all these things. So there is an opening of nasolacrimal duct. We have an opening of nasolacrimal duct. So pilocarpine will block that opening of nasolacrimal duct. And the name of that opening of nasolacrimal duct is known as punctum. So this medicine can cause punctum blockage. Punctum blockage means the blockage of which duct? Answer is nasolacrimal duct. So as the name suggests, nasolacrimal. The duct is present in nose, or the duct which is connecting the lacrimal gland and the nose. So whatever lacrimal secretions are there, whatever tears are there, they are drained in this nasolacrimal duct. So the opening of nasolacrimal duct, we call it punctum. So this medicines can cause punctum blockage. Number four side effect of this medicine is this medicine can result in peripheral retinal detachment. So this medicine can result in peripheral retinal detachment as a side effect. We also call it PRD, peripheral retinal detachment. So there are 4 side effects of this medicine. Number 1, this medicine can make the pupil pinpoint and patient cannot see the things clearly. Number 2, because this medicine will make the pupil pinpoint, the muscles of the eyes will be contracted. When the muscles of the eyes will be contracted, patient will feel the pain in the eyes. Number 3, this medicine can cause spasm of the nasolacrimal duct opening. We call it punctum blockage. And this medicine can also cause retinal detachment, particularly in the peripheral part of the retina. We call it peripheral retinal detachment as a side effect. So how many P's we have covered regarding pilocarpine? It's an important drug for your exam. So pilocarpine is a drug. You can remember 6 or 7 P's regarding this medicine. So what are the all P's? First is pilocarpine, started with alphabet P. Now this medicine will make the pupil pinpoint. This medicine will make your pupil pinpoint, or pinpoint pupil means the meiosis. And because this medicine will make the pupil pinpoint, what happens to the peripheral angle? The peripheral angle become wide. So P is for pilocarpine, P is for pinpoint pupil, P is for peripheral angle widening, P is for increased pouring of the aqueous humor in the in the trabecular meshwork, and P also stands for decreased pressure in the eyes. And now this medicine can cause 4 side effects, that is pinpoint pupil, patient vision remain deteriorated, pain in the eyes, punctum blockage, and peripheral retinal detachment. All these things are related to this pilocarpine. So that is all about this directly acting medicine. So we have 2 directly acting medicine. One is the bethanechol, second is the pilocarpine. Now guys, there is one side effect of bethanechol which I would like to mention over here, although it's not important for your FMG exam, but it is recently been asked in your NEET PG exam. So maybe asked in your FMG exam this time. So this bethanechol, because this bethanechol is a medicine, this will act on the bladder, can cause bladder contraction, can result in other Dumbbell's effect. So this medicine can also act on the bronchioles, can cause bronchospasm. So this medicine can cause bronchospasm as a side effect. And because this medicine can cause bronchospasm, so please remember bethanechol starts with B. This medicine can act on B, that is bladder, as well as the bronchioles. So it can cause bronchospasm. So this medicine can cause bronchospasm. So it is not given to a patient of bronchial asthma. This medicine is not advisable in patients of bronchial asthma, but this question is not for your FMG, mainly asked in your NEET PG, but can be misfired in your FMG exam this year. So you can remember if you want. So that is all about directly acting medicine that we have covered. Now let's talk about indirectly acting medicines now. So if we talk about indirectly acting medicines, if we talk about indirectly acting cholinergic drugs. So indirectly acting cholinergic drugs we are going to discuss. So the drugs are cholinergic only. Drugs are cholinergic only, so ultimately all medicines will produce the effect like dumbbells. All medicines will ultimately produce the effect like dumbbells, but these medicines are indirectly acting. So how these medicines will act in the body, we have discussed the mechanism of action. These drugs are inhibitor of acetylcholine esterase enzyme. These medicines are inhibitor of acetylcholine esterase enzyme in the body. And by inhibiting the acetylcholine esterase enzyme, these medicines will increase the effect of acetylcholine. Acetylcholine will stay in the body for a longer time. Now, acetylcholine will act on the muscarinic receptor and can produce the Dumbbell's effect in the body. So, this is the indirect action of the medicine. So, these medicines are ultimately the enzyme inhibitors. These medicines are ultimately the acetylcholine enzyme, acetylcholine esterase enzyme inhibitor. Now, how these medicines can inhibit the enzyme, that we will discuss now. So how these medicines can inhibit the enzyme? There are 2 ways by which medicines can inhibit the enzyme. So these medicines can be reversible enzyme inhibitor. So these medicines can be reversible enzyme inhibitor, or these medicines can be irreversible enzyme inhibitor. So these medicines can be reversible enzyme inhibitors, or medicines can be irreversible enzyme inhibitors. So we have 2 types of enzyme inhibition, reversible or irreversible. Now what is the difference between 2? Now, whenever a medicine is considered as irreversible enzyme inhibitor, these medicines will form covalent bond. These medicines will form covalent bond with the enzyme. So, these medicines will come and form a covalent bond with the enzyme. This is an irreversible type of block. But the reversible medicines will form electrostatic bond. Reversible medicines will form electrostatic bond, and the irreversible medicines will form covalent bond. And because these medicines, which are irreversible drugs, they will form the covalent bond, body cannot break the covalent bond again. So once the covalent bond is formed, the body cannot break the covalent bond, and that's why the enzyme is blocked forever. And once the enzyme is blocked forever, the body has to make the new enzyme again. Like you have consumed a drug, Whatever enzyme is present today, that enzyme is gone forever. So that enzyme is blocked irreversibly. Now body has to make the new enzyme, and that new enzyme will take long time to recover. So these medicines action is long lasting, but the reversible medicines, they will come and bind through the enzyme, and after some time medicines get dissociated. Medicines get removed from the enzyme, so the same enzyme get activated, so we call it reversible block. So we have two types of indirectly acting medicines. One is reversible enzyme inhibitor, second is irreversible acetylcholine enzyme inhibitor. Now let's start with the first, that is reversible enzyme inhibitors. So the medicines which are reversible enzyme inhibitors, now these medicines we can further subclassify in two groups. We can further subclassify these medicines in two groups. So we have a first group of medicines, we call them tertiary medicines, and we have a second group of medicines, we call them the quaternary medicines. So we have the tertiary medicines, we have the quaternary medicines. Now if we talk about the tertiary medicines, so these medicines have CNS actions. These medicines have CNS actions present in the body, but quaternary medicines have no CNS action in the body. So what is the basic difference between tertiary and quaternary? Quaternary medicines have no CNS action in the body. Tertiary medicines have CNS action present in the body. The only difference is this. So we have, what we are discussing? We are discussing indirectly acting cholinergic drugs. These medicines are inhibitor of acetylcholine esterase enzyme. There are two methods by which medicines can inhibit the enzyme, reversible and irreversible. Reversible means the medicines will form electrostatic bond. These medicines are further of two types. Some medicines can act on CNS, some medicines will not act on CNS. Now the medicines which act on CNS, let's talk about the medicines names. The first medicine which belong to this class is donepezil. So we have a medicine, we call it donepezil. So donepezil is a medicine which is a tertiary drug. So donepezil is a tertiary drug, and now whenever we give donepezil to a patient, this medicine will increase the level of acetylcholine in central nervous system. So this medicine can increase the level of acetylcholine in central nervous system, and when you increase the level of acetylcholine in central nervous system, this acetylcholine can improve your memory. So acetylcholine can improve your memory. So acetylcholine can improve your memory. So this medicine can improve your memory, and for the same reason, this is considered as drug of choice for Alzheimer's disease. So this medicine is considered as drug of choice for Alzheimer's disease. So medicine is considered as drug of choice for Alzheimer's disease. The drug name is donepezil. So donepezil is the name of a drug, right? It's the best medicine for the treatment of Alzheimer's disease. Guys, what is Alzheimer's disease? Alzheimer's disease, you can remember like this way. Alzheimer's mein A is for acetylcholine, D is for deficiency. So patient will suffer from acetylcholine deficiency. So patient will suffer from acetylcholine deficiency. So you have to increase the level of acetylcholine in the CNS. So donepezil is a medicine which can increase the level of acetylcholine in CNS. So this medicine can be used as a drug of choice for Alzheimer's disease. So donepezil is a medicine. It's a drug of choice for Alzheimer's disease. Now we have a second drug over here. The drug name is rivastigmine. So we have one more drug, rivastigmine. Now rivastigmine is a medicine. This is also given for Alzheimer's disease. This medicine is also given for the treatment of Alzheimer's disease. But the important point here is this medicine can be given in the form of skin patch. So rivastigmine is a drug which can be given in the form of skin patch. So donepezil, drug of choice for Alzheimer's, and rivastigmine is a drug which can be given in the form of skin patch. Now we have a third medicine over here. The third medicine here is known as physostigmine. So we have a third medicine over here. The drug name is physostigmine. Now physostigmine is a drug which can increase the level of acetylcholine everywhere in the body. So this medicine can increase the level of acetylcholine everywhere in the body. Now this medicine is considered as drug of choice. This medicine is considered as drug of choice or the antidote of choice for anticholinergic drug poisoning. So if a patient has taken a drug which is an anticholinergic drug. Guys, what is anticholinergic drug? That we have discussed already. The medicine that will act opposite to the cholinergic drugs. So the medicines which act opposite to the cholinergic drug. So if the patient has taken high dose of those medicines. If the patient has taken high dose of those medicines, we call it anticholinergic drug toxicity. One of the classical example of the anticholinergic drug is atropine. So atropine is a drug which starts from alphabet A. Atropine is a medicine starts from alphabet A. It is an anticholinergic drug. So whenever patient suffering from atropine poisoning, Whenever patients suffer from atropine poisoning, it's a type of anticholinergic poisoning. So physostigmine is a drug of choice for that condition. Now, this atropine is a chemical compound which we can use as a drug. Also, this chemical compound is present in a natural fruit. We call it datura. So sometimes patient of atropine poisoning has come to you after consuming a toxic fruit basically. Datura fruit is there. So by accident, the patient will consume this datura fruit and patient can come to you with datura poisoning. So datura is a fruit that contains an active compound. We call it atropine. So datura poisoning, atropine poisoning is an example of anticholinergic poisoning or anticholinergic toxicity. And the antidote of choice for this toxicity or the best treatment of choice for atropine toxicity is physostigmine. So these medicines are the tertiary medicines we have discussed. So tertiary medicines are those drugs where the patient will come to you with CNS symptoms. Patient will have problem of CNS symptoms. CNS of the patient is involved. Patient will have the brain symptoms. So donepezil, the first disease is Alzheimer's disease, where the patient will have acetylcholine deficiency in the CNS. So patient will suffer from dementia. So patient will come to you with dementia. What is dementia, guys? Dementia is a forgetfulness. The patient has loss of memory. So donepezil is considered as drug of choice. Rivastigmine is a drug that can also be given for same disease but given in the form of skin patch. The third medicine we have discussed is physostigmine. So physostigmine is drug of choice or antidote of choice for anticholinergic poisoning or atropine poisoning. So these medicines are considered as tertiary medicines that will act on your CNS. Now let's move on to the quaternary drugs. Now if we talk about the quaternary drugs, now these medicines which are quaternary drugs, these medicines will increase the acetylcholine level in the periphery. And when you increase the level of acetylcholine in the periphery, this acetylcholine can act on muscarinic receptor. The same acetylcholine can also act on nicotine M receptor. So these medicines will increase the level of acetylcholine in the periphery, not in the CNS. Now these medicines, this acetylcholine will act on the muscarinic receptor and can cause contraction of the smooth muscle. Can cause contraction of the smooth muscle. Now same acetylcholine which is increased by these medicines will act on the NM receptor. Now guys, if I ask you this question, where do we have the NM receptor? Your answer will be, sir, this receptor is a part of somatic system, voluntary system. So even the skeletal muscles will also get contracted. So these are the drugs which are given to contract the muscles of your body. These medicines are given to contract the muscles of your body. So whenever patient is suffering from muscle weakness, these drugs are mainly given for the treatment of that muscle weakness. So whenever the patient will suffer from muscle weakness, these medicines are always preferred. So quaternary drugs are mainly given for CNS problem, mainly given for non-CNS problem like the muscle weakness. So muscle weakness is a peripheral problem where CNS has nothing to do. CNS symptoms are not there, only the peripheral symptoms are there. Now here you prefer to use the quaternary drugs because these quaternary medicines will increase the level of acetylcholine and can contract both smooth muscles as well as skeletal muscles because the same acetylcholine which is increased is required by both muscles to get contracted. The only difference is the receptor. We discussed already. On voluntary muscles, we have NM receptor. On involuntary muscle, we have muscarinic receptor. The only difference is this. Rest neurotransmitter is same that is required for muscle contraction. So these medicines are mainly given for muscle weakness. So which drugs are present over here? We have the presence of a medicine over here. The drug name is pyridostigmine. We have a medicine over here. The drug name is pyridostigmine. So pyridostigmine is a medicine which is considered as drug of choice for a muscle weakness disorder. We call it myasthenia gravis. So we have a muscle weakness disorder. We call it myasthenia gravis. So as the name suggests, myasthenia gravis. Myasthenia means muscle. Myasthenia means muscles and gravis means graveyard. Gravis means graveyard. So muscles are in graveyard. Muscles are in graveyard. Muscles are weak. Muscles are dead. So in this patient of myasthenia gravis, the patient will come to you with muscle weakness. Muscles are in graveyard. Muscles problem is there. So pyridostigmine is the drug. So guys, please remember what is myasthenia gravis. Myasthenia gravis is a condition where the patient will have production of the antibodies, synthesis of the antibodies in the plasma, and these antibodies will destroy the NM receptor. These antibodies will destroy the NM receptor, and when these antibodies will destroy the NM receptors, the number of NM receptors are less in the body. So when you give pyridostigmine by increasing the acetylcholine level can bring this muscle strength back. So although the NM receptors are less in the number, but when you increase the acetylcholine level by inhibiting the acetylcholine esterase enzyme. So these drugs are acetylcholine esterase enzyme inhibitor. We discussed already. These medicines are acetylcholine esterase enzyme inhibitor. So when you block this acetylcholine esterase enzyme in periphery, now the acetylcholine level will increase and now the muscle strength will come back because the acetylcholine which is increased will act on the NM receptor for a longer time. So whatever the less number of receptors are there, that we can overcome by increasing the level of acetylcholine. But the problem here is whenever we give pyridostigmine to a patient, we will increase the level of acetylcholine. Now this acetylcholine is required to increase the muscle strength of the somatic system. Myasthenia gravis is a problem of somatic system because antibodies will destroy the NM receptor. We don't want to stimulate the autonomic system here. Right? So in myasthenia gravis, we just want to stimulate the somatic system because it's a problem of somatic system. We don't want to stimulate the autonomic system. But what happens over here? Whenever we increase the level of acetylcholine, not only the somatic system via NM receptor, even the autonomic system is also stimulated. And when this autonomic system is stimulated, now this patient will be having the side effect. So pyridostigmine is a drug that can cause autonomic side effect. So if I discuss the side effect of pyridostigmine, this medicine can cause autonomic side effect, that is dumbbells. So the acetylcholine which is increased over here, this acetylcholine will act on the muscarinic receptor, and by acting on the muscarinic receptor, this can result in a symptoms, that is dumbbells. So can result in a symptoms, that is dumbbells, and this is something which is not required. Right? So how we can treat this patient? How we can prevent all the side effects? What we can do? We can give low dose of atropine. So there is a drug, we call it atropine, we discussed already. It's a type of anticholinergic drug. This medicine is a blocker of muscarinic receptor. This medicine is blocker of only muscarinic receptor, not the NM receptor. So along with pyridostigmine, I can give atropine to avoid autonomic side effect. So to avoid the autonomic nervous system side effect, I will give atropine along with pyridostigmine to avoid this problem. So we have a first quaternary drug. The drug name is pyridostigmine. It's a drug of choice for myasthenia gravis. This medicine, what is a myasthenia gravis? Myasthenia gravis where the antibodies will destroy the NM receptor and patient will have voluntary muscle weakness. Patient will have voluntary muscle weakness. So when you want to gain the strength of these voluntary muscles, what exactly you have to do? You have to increase the level of acetylcholine. The receptors which are destroyed cannot come back. Now what you can do, you can increase the level of acetylcholine. So whatever NM receptors are there, even those will be stimulated for a longer time and patient will gain the muscle strength back. But whenever you increase the acetylcholine level by giving the pyridostigmine, this pyridostigmine not only increase the effect of acetylcholine in somatic system, but also increase the effect of acetylcholine in the autonomic system. So we have to block that autonomic side effect of the medicine by giving the low dose of atropine. This is the role of low dose of atropine along with pyridostigmine. So first quaternary drug is pyridostigmine. Now let's move on to the second quaternary drug. Now second quaternary drug here is neostigmine. Now if I talk about neostigmine drug here, now neostigmine is a medicine which is present over here. Now this medicine has very fast onset of action. This medicine has very fast onset of action, and because this medicine has very fast onset of action, whenever you want to gain the muscle strength, whenever you want to gain the strength of a patient muscles acutely, like patient is having acute muscle weakness because of some emergency condition, patient has lost the muscle strength, patient has got the muscle paralysis. Now you want to gain the muscle strength immediately, acutely in an emergency. Now this is preferred. So neostigmine is preferred in acute emergency. For example, whenever patient is bitten by cobra, whenever patient is bitten by cobra, cobra is a neurotoxic snake. So whenever the patient is bitten by cobra, so this cobra will release the venom, and this venom will also block the NM receptor. So venom will block the NM receptor and patient can develop the muscle weakness immediately. Patient cannot walk till the hospital. Patient cannot come to the hospital. Patient cannot breathe properly because all muscles are paralyzed. This is the cobra bite. So in this case, we have to give anti-snake venom. We have to give the antidote of venom. We call it anti-snake venom. But along with anti-snake venom, we have to give neostigmine to gain the muscle strength back. So whenever we want the muscle strength back, along with the anti-snake venom, we have to give neostigmine. But again, the same problem. Whenever we give neostigmine, we not only increase the strength of the somatic muscle or the voluntary muscle, we also get the increased strength of the involuntary muscle that is not required. So here again, I have to give low dose of atropine along with this neostigmine. So low dose of atropine is again given. So it is the exact treatment of cobra bite. Whenever the patient has come to you with cobra bite, you have to give anti-snake venom that is ultimately going to neutralize the venom of the snake. Plus, to gain the muscle strength immediately so that the patient can breathe properly, you have to give neostigmine. And just to counter the autonomic side effect, just to counter the autonomic side effect of this neostigmine, we have to give low dose of atropine. This is how we treat a patient of cobra bite. So neostigmine is a drug. Neostigmine is a drug which is a drug of choice for cobra bite given along with anti-snake venom. Now, neostigmine is also considered as drug of choice for post-operative reversal of skeletal muscle relaxant. Now, guys, what is skeletal muscle relaxant? Do you remember? So, discussed already. Skeletal muscle relaxants are the drugs like curium and the chironium. So, skeletal muscle relaxants are the medicines which are blocker of NM receptor and can cause muscle paralysis during surgery. So, whenever we have to perform the surgery, we have to paralyze all the patient muscles so that the patient limbs will not interfere during the surgery. So, all muscles of the patients are paralyzed. We can put an artificial respiration tube in the patient body, and now we perform the surgery. Now, after the surgery is over, we want that patient muscle strength should come back and patient can breathe by himself. And when we want that patient should breathe by himself, we want a reversal of skeletal muscle relaxant. And if we want a reversal of skeletal muscle relaxant, we have to give a drug that should act very fast, and the drug is neostigmine. So neostigmine is also considered as drug of choice for post-operative reversal of skeletal muscle relaxant because here again we required a fast action. So it is a drug of choice for cobra bite. It is also a drug of choice for post-operative reversal of skeletal muscle relaxant. And for the same reason, this medicine is also given for the treatment of post-operative retention of urine. So this medicine can increase the muscle strength, and now we want to gain the smooth muscle strength. The smooth muscles contraction we want, and when we want the contraction of the smooth muscle of the bladder, I can give neostigmine again. So I can use this medicine for post-operative retention of urine, where it will increase the level of acetylcholine, and now the acetylcholine will act on the muscarinic receptor and can cause contraction of the bladder muscle. So it is given for the treatment of post-operative retention of urine also. The drug is neostigmine. So we have two medicines which are quaternary that we have discussed. Number one is pyridostigmine. That is a drug of choice for myasthenia gravis. The second drug is neostigmine. That's a fast onset of action. So we prefer it for acute condition like cobra bite. Second is post-operative reversal of muscle relaxant and post-operative retention of urine. Now we have a third drug over here. The third drug is edrophonium. So edrophonium is the third medicine. Now this medicine is a very short acting medicine. And because of this medicine very short action, I cannot use this medicine for treatment of any disease. Because if I use this medicine for treatment of any disease, the patient has to take this medicine multiple times daily, and that is not feasible. So because of its short action, I will use only this medicine for diagnosis of myasthenia gravis. So whenever I want to diagnose myasthenia gravis, I will use this medicine edrophonium, and the test that I use for diagnosis of myasthenia gravis is known as tensilon test. So the test where I use this medicine for diagnosis of myasthenia gravis, the test is known as tensilon test. Right? Now this test is outdated. That's why the questions are generally not asked on this test. So just remember, edrophonium is a short-acting medicine given for diagnosis of myasthenia gravis. Right? So this is the only important point regarding this medicine. So guys, we have discussed three medicines which are quaternary drugs. So these quaternary drugs you can remember by a mnemonic: pen, pyridostigmine, edrophonium, and neostigmine. Now, if we talk about the mnemonics, pyridostigmine. Now, in the pyridostigmine drug, you find the word dosti. So, according to some students, like whenever the patient is having myasthenia gravis, there is a muscle weakness. Patient cannot lift his hand. Patient cannot lift his hand to shake the hands. Patient cannot lift his arm to shake the hand with you. So, patient cannot do the dosti with you. So if you give pyridostigmine, now patient can do the dosti with you, patient can shake the hand with you. So pyridostigmine is a medicine which is having the word dosti. Why I am saying this word? Because students usually get confused between pyridostigmine and the physostigmine. So if you look at here, we have a drug physostigmine. So it is a drug of choice for the datura poisoning, atropine poisoning. And we have a pyridostigmine. So almost same spelling, same name, same initial, like same word from where the medicine name is starting, P. So don't get confused. Pyridostigmine is having the word dosti. So this medicine is given for myasthenia gravis, where the patient can lift his hand for shake hand. And now the neostigmine. Neostigmine is a fast-acting medicine. So neo means N. N is for neurotoxic snake. So cobra bite is a neurotoxic snake. It starts with the word neu. So medicine is given for neurotoxic snake bite, right? And also we have a drug edrophonium. Edrophonium is a short-acting medicine. It is given for diagnosis. So short-acting medicine given for diagnosis. Pyridostigmine given for myasthenia gravis. Neostigmine given for the acute conditions. So this is all about the quaternary drugs. So we have two types of medicines. One is known as reversible inhibitors. Second is known as irreversible enzyme inhibitor. So reversible enzyme inhibitors we have discussed. The medicines are of two types, tertiary and the quaternary, that we have discussed in detail. Now let's move on to the medicines which are indirectly acting medicines, but these are the irreversible blockers. These medicines will form covalent bond. So let's talk about the drugs which are irreversible inhibitors. So if we talk about the medicines which are the irreversible inhibitor of acetylcholine esterase enzyme. The medicines which are irreversible inhibitor of acetylcholine esterase enzyme. So the drugs are irreversible inhibitor of acetylcholine esterase enzyme. So these medicines will form which type of bond? The answer is the medicines will form covalent bond. Now again we have two types of medicines over here. First is known as organophosphates. First group of medicine here is known as organophosphate. The second group of medicine here is known as carbamates. So we have two types of medicines. One is known as organophosphates. The second is known as carbamates. Now, both of these medicines are poisons for human being. So they are the poisons for human being. So we're going to discuss the organophosphate poisoning and the carbamate poisoning. Now, both medicines are used in agriculture for the insecticides and the pesticide purpose. So they are given to kill the insects and pests. So if a human will consume the medicine, if a human will consume this medicine by mistake or in a purpose of committing the suicide, right? So in a purpose of committing the suicide, patient can consume the drug, or by mistake, patient can consume the medicine. Now, if a patient will consume organophosphate, now this medicine is going to block this enzyme irreversibly. So this was our enzyme, acetylcholine esterase enzyme. This enzyme has two sites. What are the names of two sites? One is known as anionic site, the second is known as esteric site. So if the patient has consumed organophosphates, please remember, organophosphates will come and bind to only esteric site. And when this organophosphates will come and bind to the esteric site, now this enzyme cannot recognize organophosphate. This enzyme can recognize acetylcholine. So if acetylcholine will come, it will easily recognize it and it will metabolize acetylcholine. But when organophosphate will come here, this enzyme cannot recognize this organophosphate. So this enzyme cannot metabolize organophosphate at a very fast speed. Because organophosphate structure is different from acetylcholine, enzyme will take long time to metabolize or to dissociate organophosphate from its active site. Now, because organophosphate metabolism here is very slow, so organophosphates will get chance to make a covalent bond over here. So, when organophosphates will get more time on this active site of the enzyme is not able to recognize the structure of this compound. So, enzyme is taking longer time to dissociate this organophosphate. Now, organophosphates will get sufficient time to make the covalent bond. And once this organophosphates will make the covalent bond, this process is known as irreversible block, and we also call it the process of aging. Aging means, like you must be knowing in Hindi, we call it budhapa. Aging means now the age has already been progressed. Now it cannot reverse back. Now the block has become irreversible. So this is the other name of irreversible block. We call it process of aging. So organophosphates will make a covalent bond. The process is known as aging. The block is irreversible block. Understood this point up till here? So organophosphates first of all come and bind with the esteric site, and now they are not dissociated, and now they will get sufficient time to make the covalent bond. The same story happens with carbamates also. So whenever patient consume carbamates, again we have the presence of same enzyme, acetylcholine esterase enzyme. Again this enzyme has two active sites. One is the anionic site, second is the esteric site. Now carbamates come and bind to the both sides. Carbamates will come and bind to the both sides, and now enzyme again cannot recognize the structure. So this carbamate metabolism is again very slow. So carbamates will have lot of free groups and they will take sufficient time. They will have the sufficient time to make the covalent bonds, and now the process is again aging and the block is irreversible. And now when this block is irreversible, acetylcholine cannot be metabolized. Acetylcholine wants to come and bind with this enzyme. for its metabolism. Now acetylcholine metabolism is not possible. Acetylcholine level is keep on increasing in the body, and when this acetylcholine level is keep on increasing in the body, this acetylcholine will act on the muscarinic receptor and can produce the symptoms which are dumbbells. So what are the sign and symptoms of OP poisoning and carbamate poisoning? The answer is sign and symptoms of OP poisoning and carbamate poisoning is same as dumbbells, and this is due to the muscarinic receptor. So acetylcholine will act on the muscarinic receptor. Patient will come to you with pinpoint pupil. Patient will have diarrhea. Patient will have urination. Patient will have bronchospasm, bradycardia, lacrimation, salivation. All these symptoms are there. So this is the symptoms of organophosphate and carbamate poisoning. Now, which medicine is given to immediately treat the patient? So we have a medicine over here. The drug is blocker of muscarinic receptor. We call it atropine. So whenever this patient will come to you, atropine is a drug that we have discussed already. Atropine starts with A. It's an anticholinergic drug. This medicine is blocker of all muscarinic receptor. This medicine is blocker of all type of muscarinic receptor in the body. So this medicine is considered as antidote of choice. This medicine is considered as antidote of choice or drug of choice for the treatment of OP poisoning and the carbamate poisoning. So this is the antidote of choice, drug of choice for the treatment of OP poisoning, organophosphate poisoning and the carbamate poisoning, because this medicine will take care of all the symptoms which are responsible for this patient poisoning. So all symptoms which are seen in this patient can be blocked by the atropine. It's the best medicine for the treatment of this condition. Now, apart from atropine, we have the presence of one more drug. We call them oximes. So apart from atropine, we have a group of medicines, oximes. Now, please remember, oximes starts from alphabet O. We have a drug over here. The drug name is pralidoxime. So the drug which is example of oxime is pralidoxime. So this medicine is having the word oxime in its name. So oximes is a group of medicine that starts with alphabet O. Now these medicines are useful only in organophosphorus poisoning. So these medicines are only useful for organophosphorus poisoning. So O is for O. You have to remember like this way. Oxime starts with O. They are useful only for O, that is organophosphorus. Now the question will be asked to you, why these oximes are useful only for organophosphorus poisoning, not for carbamate poisoning? The answer here is the oximes are useful for organophosphorus poisoning because in organophosphorus poisoning, the anionic site is free, but in carbamate poisoning, this anionic site is occupied. Now the question arises, what's the significance of this? The significance of this point is like this way. So if I say this is the acetylcholine esterase enzyme and organophosphates have attached to this esteric site. Now the anionic site is free. Now what will happen whenever I give oximes to a patients? So oximes are the drugs which contains the positive charge. Oximes are the drugs which contains the positive charge. So they will come and bind with the anionic site. And once they will come and bind with the anionic site, now they will start making bond with the organophosphates. And once they will make the bond with the organophosphates, now organophosphates will not have any free group to make the covalent bond here. So organophosphorus will not left with any free group to make the covalent bond, and now organophosphorus will not be able to make the covalent bond. So the block is not going to be irreversible. So block remain reversible, block will not be changed to irreversible. The block here is electrostatic bond, the bond here is electrostatic bond, will not become covalent bond because all free groups of organophosphates are utilized by the oximes. So now the body which is trying to remove this organophosphate at a slow rate, after sometimes this organophosphates are removed, and once the organophosphates are removed by the body, now the enzyme is again reactivated. Enzyme is again reactivated, and once the enzyme is again reactivated, now this acetylcholine can be metabolized by the same enzyme. So what is the purpose of oximes? Oximes are the drugs which are useful only for the OP poisoning because the anionic site is free. And what is the best time of giving? What is the best time of administration? What is the best time of administration of oxime? What is the answer? The answer is the best time of administration of oxime is before the process of aging. So before the aging will take place. What is the aging, guys? Aging means the covalent bond formation. Because once the covalent bond formation has taken place, once the organophosphates, all groups are utilized in covalent bond formation. After that, if you give oximes, you cannot give any advantage to the patient. So best time of oxime administration is before the process of aging. So medicines are given before aging. After the aging, if you give, the medicines have no use. So these medicines are useful only in OP poisoning. Why only in OP poisoning? Because these medicines contains the positive charge, and positive charge need to bind with the negative site. And that negative site is free only in acetylcholine esterase, only free in acetylcholine esterase in cases of OP poisoning, not free in case of carbamide poisoning. So if you go back, so look at here, this site is free here, but this is not free in case of carbamide poisoning. So in OP poisoning, oximes are useful because the enlightening site is free. What is the best time of giving? These medicines are given before the process of aging. And what is the purpose? These medicines can remove organophosphates from the enzyme and the enzyme get reactivated. So these medicines are given before the process of aging. The enzyme can be reactivated. But if you give the medicines after the aging, the enzyme will not be reactivated, so body has to make the new enzyme again. So body is ultimately has to make the new enzyme again. So body is making new enzyme, but if you let this old enzyme to come back, if you let this old enzyme to recover, then the process of recovery will be faster. The only advantage is this. So oximes cannot treat any symptoms. Oximes cannot treat any symptoms, so they are not the antidote of choice. They are not the life-saving drug. The life-saving drug here is atropine only. So atropine is the antidote of choice. Oximes are only given in OP poisoning so that this enzyme can be reactivated and the process of recovery will be faster. Now that is all about these indirectly acting medicines which are irreversible. So what we have discussed so far, we have discussed cholinergic drugs. We have discussed cholinergic drugs. Now, these cholinergic drugs can be of two types. One is known as directly acting, second is known as indirectly acting. Now, in directly acting medicines, we discussed that the medicines can stimulate the receptor directly. Now, these medicines are of two types. We discussed that. One is known as bethanechol. Now, bethanechol is a drug that is given to stimulate the bladder. Bethanechol is a drug which is given to stimulate the bladder. It's a drug of choice for atonic bladder. The side effect is bronchospasm. The second drug that we have covered over here is pilocarpine. Now, pilocarpine starts with the word PI, that's a pinpoint pupil. So, this medicine is given in the form of eye drop. This medicine will make the pupil pinpoint, open the peripheral angle, increase the trabecular outflow, increase the drainage of the aqueous humor. So, pilocarpine is a drug that is given for the angle closure glaucoma treatment, and there are 4 side effects that you can remember by a mnemonic 4P. Now we have indirectly acting medicines. Now indirectly acting medicines are blocker of acetylcholine esterase enzyme. And by blocking acetylcholine esterase, this can increase the level of acetylcholine. Now medicines which block acetylcholine esterase, these medicines we can divide in two groups. The medicines can be reversible inhibitor. The medicines can be irreversible inhibitors. So the drugs which are irreversible inhibitors, they are actually the poisons for human being. We discussed two group of medicines, organophosphates and the carbamates. So organophosphates and the carbamates are the two medicines, and we discussed that the antidote of choice is atropine. Antidote of choice is atropine, and oximes are the drugs which are only useful for the treatment of OP poisoning, not for the carbamate poisoning. Now, after the reversible drugs, we discuss some reversible drugs also. Under reversible drugs, we discuss that we have two types of drugs. One is the tertiary medicines. The second is the quaternary medicines. So, we have the tertiary medicines, we have the quaternary medicines. Now, tertiary medicines are given for CNS problem. For example, we discussed a medicine donepezil. Donepezil is drug of choice for Alzheimer's disease. Second, we discussed the drug name is physostigmine. So, physostigmine is a medicine which is drug of choice for atropine poisoning, datura poisoning. In quaternary drugs, the medicines which will not act on central nervous system, these medicines are 3 in number. We discussed 3 medicines, pyridostigmine, edrophonium and neostigmine. So pyridostigmine is drug of choice for myasthenia gravis. Edrophonium is a short-acting medicine given for diagnosis of myasthenia gravis. And neostigmine is a drug that is given for neurotoxic snake bite, that is for the cobra bite. And neostigmine is also given for the recovery of the non-depolarizing muscle relaxant effect, that is a skeletal muscle relaxant effect. They call it neostigmine. So all these things we have discussed on this topic of cholinergic drugs. That's all about this topic. I hope you have liked this video.